GAMT, which is the condition that we want to try to treat with this inhibitor. This slide reminds you of GAMT deficiency, which is one of the brain creatine deficiency syndrome. And what I want to focus on is how do we treat this disease? We give supplement of creatine, and we give, but those by themselves are not sufficient. The first few patients were treated with creatine alone, and they still suffer severe problem with that therapy alone. For this reason, in addition to giving creatine, we need to lower the concentration of guanidino acetate, or GAA, whose level can be toxic to brain development and function. And to do that, what we do, we give supplement with ornithine and sodium benzoate. Why? The reason is that if we look at the enzyme combines glycine and arginine to synthesize ornithine and guanidino acetate. All enzymes are inhibited by the product of the reaction. So if we give ornithine, we inhibit the activity of the enzyme. Also, the activity of the enzyme depends on the concentration of substrate. We give a low protein diet to limit the concentration of arginine, and we give sodium benzoate that combines glycine to generate hippuric acid, which is excreted in urine. So in this way, we limit the substrate. We provide an excess of a product of the reaction to decrease the activity of the AGAT enzyme. Keep also in mind that when we provide creatine, we suppress a little bit the expression of the AGAT enzyme, so at the gene level. Now, what do we obtain with this therapy? With this therapy, obviously, we improve delays and seizure. Intellectual disability is usually not reversed, even though development can be significantly improved. Early treatment at birth is obviously the key, and we depend for that one on neonatal screening. Even with the best therapy that we have today, the level of guanidino acetate remains significantly elevated in plasma despite all we can do. And even though patients treated at birth do very well, many times they seem not to do as well as their siblings. So in other words, they are not delayed in the traditional sense. They do not develop seizure, but they might not do as well as their sibling. We are seeing a little bit with what we have seen in other metabolic diseases, such as phenylketonuria or PKU or galactosemia. What we have done, we have treated those conditions with the idea of reducing metabolite, and we find that obviously reducing the metabolite helps, but in the long term, we can still have some subtle deficiency if we do not normalize the metabolites. And the other thing that we know is that the outcome is usually better in AGAT deficiency, probably due to the lack of GAA accumulation. And the treatment in AGAT deficiency is simply by giving creatine. So the question is, can we simplify therapy in GAMT deficiency by eliminating the activity of the AGAT enzyme? Now, how do we do to eliminate the activity of the AGAT enzyme? So we try to identify a reversible or irreversible inhibitor of this enzyme that would prevent the formation of guanidino acetate. So in this way, we should be able to normalize their level. So we started working on the project by trying to synthesize significant amount of the AGAT enzyme against which we could test the activity of inhibitor. And when we started to do the purification, we were able to see this is a gel that shows the production of the AGAT enzyme, which is the one circled here. And we were able to synthesize that in bacteria, but when we were trying to purify it, we were not able to obtain anything out of the colon. Why was this happening? And then, we have always to think to the physiology of this enzyme. So this enzyme is usually very highly expressed, especially in the kidney. And then once the guanidino acetate is produced, it has to travel especially to the liver, where the GAMT enzyme is highly expressed and complete the conversion to creatine. And then creatine can reach all the organs in the body by the action of the creatine transporter. But pretty much guanidino acetate needs to travel from kidney to the liver and other organs to give rise to the synthesis of creatine. Now, where does the synthesis of guanidino acetate happen within the kidney? And this is a very nice slide that shows where mitochondria are within kidney cells that are stained in green. Sorry, they are stained in red here in the second panel. And also shows where the AGAT enzyme is, which is stained in green. When the one is on top of the other, you see the formation of a very nice yellow color. And you can see that basically all of the AGAT enzyme, at least in the kidney, is localized within mitochondria. What is the problem with this? The problem with this is due to the fact that all of the mitochondrial protein require a signal peptide to direct the protein within mitochondria. And obviously we believe that the presence of this this signal peptide would have diminished our capacity to recover the AGAT enzyme when we did the first purification. For this reason, we engineer a different type of vector in which we substituted the leader sequence with a polyhistidine tag. And with this type of approach, we were able to obtain finally the AGAT enzyme that you can see here in this slide. So this allows us to recover a significant amount of enzyme from our bacterial culture. Now that we have the enzyme, we started testing its activity, and we were able to demonstrate a linear dependence on the amount of protein that we were able to apply to the reaction, to the production of ornithine, which is obviously one of the reagents that we observe in the reaction. And this is pretty much where the point where we are now. So at this point, what we are doing with the collaboration with additional collaborators, we are trying to convert this assay to a high throughput assay using tandem mass spectrometry to be able to measure the activity in multiple well places to be able to identify inhibitors of the AGAT enzyme. Inhibitors that should block the production both of ornithine and obviously guanidino acetate. Now, how do we get the inhibitor that we are going to test for identifying possibly new drugs? You have seen in the previous slide how people are modeling different the creatine transporter against known structures of other membrane transporter. In the case of the AGAT enzyme, we actually have a pretty well-defined crystal structure of the AGAT enzyme. And we also know very well where is the active site of the enzyme. We know where arginine binds and forms a hydrogen bond with some of the amino acids that are part of the active site. We know the cysteine 407, histidine 303, and aspartate 254 are involved in binding arginine. So with this knowledge, we have that Atomwise, which is our partner in the discovery of new molecule, has done virtual screening and then identified and synthesized 100 putative inhibitors, and we already have received them. So at this point, we are just awaiting to place the inhibitor in the reaction and then try to see if they're able to block the formation of guanidino, acid, and ornithine with the enzyme that we have been able now to purify and with the reaction that we have been trying to set up. So in summary, AGAT and GAMT deficiency impair creatine synthesis, with GAMT deficiency also resulting in guanidino acetate accumulation. Therapy with creatine administration is very effective in AGAT deficiency, while suppression of GAA synthesis is also necessary in GAMT deficiency. Inhibition of AGAT could decrease synthesis of guanidino acetate, not just reducing level, but restoring normal level of this compound in the brain. An inhibitor of AGAT together with creatine supplement could greatly improve the outcome of patients with GAMT deficiency. And I want to thank all of the collaborators of this study, mostly Bijina Balakrishnan, who has performed the purification of the AGAT enzyme, Dr. Kent Lai, who worked with us in developing the assay and measuring the ornithine, Dr. Neil Henriksen at Atomwise that have performed the virtual screening and synthesized the compound that we have been tested, Dr. Marcia Pasquali and Dr. Filippo Ingoglia at ARUP, who have set up the tandem mass assay to measure the concentration of the chemical that will allow the screening of the new molecule. So unfortunately, the COVID has slowed us down, but we are ready to go, and we are very excited about this project.
Thanks so much, Dr. Longo. It was beautiful to see all this progress